Friends, a small cough, but one that can steal your sleep at night, make breathing difficult, and put the lives of little children at risk. This is whooping cough, also called pertussis. Today we will discuss in detail what this disease actually is, where it comes from, what its symptoms are, who is most at risk, and most importantly, how it can be prevented and treated. Whooping cough, or pertussis, is a bacterial infection that affects the lungs and respiratory tract. It is caused by a bacteria called Bordetella pertussis. When this bacteria enters a person's airways, it causes swelling and irritation. Because of this irritation, the patient suffers repeated and intense coughing fits. This disease is most commonly seen in children, but adults can also get infected, especially if their vaccination is not complete. Now let's talk about the symptoms. In the beginning, whooping cough looks like a normal cold. The patient has a mild cough, runny nose, fever, and watery eyes. But after a few days, the symptoms change. The cough becomes severe and comes in long and intense fits, making it very difficult for the patient to breathe. When the patient takes a breath after coughing, a whoop sound is heard, which is why this disease is called whooping cough. Small children sometimes turn blue during these coughing fits because their breathing stops, and in many cases vomiting also occurs. These fits are often worse at night, which makes it difficult for both the patient and their family to sleep. Friends, this disease is not only dangerous but also highly contagious. If even one child in a household gets infected, the rest of the family is also at high risk. It spreads through coughing and sneezing, and anyone who breathes in that air can catch the infection. That's why doctors always recommend isolating the patient so that others can be. The most vulnerable groups are children, especially newborns who have not yet received their vaccines. Next are pregnant women and their newborn babies. Elderly people or those with weak immune systems are also at higher risk. Now let's talk about prevention. The most effective solution to this disease is vaccination. Children are given a special vaccine called the DTP vaccine, which protects against diphtheria, tetanus, and pertussis. This vaccine is given in different stages during childhood, and later booster doses are also required. If the vaccination is complete, the risk of whooping cough becomes very low. Unfortunately, many parents ignore vaccines, and as a result, children easily fall victim to this infection. If someone does get pertussis, doctors usually prescribe antibiotics to control the bacteria. Patients are also advised to rest, drink plenty of fluids, and in severe cases, children may need to be admitted to the hospital to support their breathing. Getting treatment on time is very important. Otherwise, complications like pneumonia, dehydration, and in small children, even sudden death can occur. Friends, you may be surprised to know that whooping cough is not just an old disease that has disappeared. Even today, outbreaks are occurring in many countries, including the United States and Asian countries. Wherever vaccination rates are low, pertussis spreads more easily. That is why both awareness and vaccines are extremely important. So friends, coughing happens to everyone, but not every cough is normal. If you or someone in your home has a cough that doesn't go away, difficulty breathing, or if children's skin turns blue during coughing fits, consult a doctor immediately. Don't forget to complete your children's vaccination, because that is their strongest protection in life. See you in the next video. Thanks for watching.